Hi everyone, I'm Dr. Stuart Lustig and I'm a psychiatrist and a medical executive with behavioral health at Cigna. These are extraordinarily difficult times that we are all living through right now, and social distancing is particularly difficult for those of us who may already be somewhat isolated, such as our seniors. Many seniors are in nursing homes, which have been very badly hit by this virus, and there are a lot of answers out there right now for how to help people. What I'd like to do is share with you some questions, specifically some questions that you can use to talk with the seniors in your life who may be under your care or under the care of other people in places like nursing homes. So first of all, it's helpful to ask the staff, for starters, how best to stay connected. Now, this may vary from facility to facility, but for example, are there ways to have daily phone calls with your loved ones? Ask the staff about that. Or better yet, video calls for those seniors who are able to participate in those. Are there things that maybe you can bring in from home, for example, whether it's photographs or books or other things that are meaningful to them and that can be brought in safely and cleanly to the facility? So it's worth checking in, first of all, with the staff that are taking care of your loved ones. Secondly, routines are worth asking about. Routines are something that help all of us feel like we have a bit more control over our lives and can help to reduce the anxiety that we're all experiencing at these times. So basic things that you can talk with your loved ones about are routines around getting up in the morning. Are they getting up at the same time? Are they having meals at the same time? Are there maybe special programs on TV or on the radio that they like to listen to that they are still able to do on a routine basis? And having those basic structures in their lives can be helpful as they try to connect with others, but particularly as they try to maintain some sense of normalcy during these extraordinary times. Finally, it's also worth asking about how active they are and if they're able to maintain any kind of activity. Obviously, being isolated in a room or a confined space limits the amount of activity that people can have. That said, there may still be things that they can do in their own rooms, for example, to stay active. Activity, we know, increases the neurotransmitter serotonin in the brain, which is associated with well-being. And so it is a good thing in and of itself to stay active, even if it's the kind of thing that you're doing on your own. So those are the questions that I would recommend asking staff and the seniors that they're taking care of who are in your life about. So how to stay connected, changes in routine or how to maintain a routine, and staying active. So as we all make it through social distancing together at this time, it's important as ever to take control of one's mental well-being as much as possible. So thank you for listening, and for further resources, feel free to visit cigna.com/COVID-19.